Hi, I'm Dr. Wheaton Williams. I'm an infectious disease physician at Catawba Valley Health System, and I'd like to spend a few minutes talking to you about COVID-19 vaccine side effects and also our obligation to protect ourselves and our patients from COVID-19 through immunization. As healthcare workers, we have a long history of using vaccines to protect ourselves and our patients from infectious disease threats. Currently, we're all screened for immunity to viruses such as measles, mumps, rubella, hepatitis B, varicella, and immunization with influenza to make the hospital a safer place for our patients. The COVID-19 pandemic and the availability of the COVID-19 vaccine is another opportunity for us to make the hospital a safer place, to protect ourselves, our family, our loved ones, and our patients from this horrible virus. So I know that many people have particular concern with the mRNA vaccines because this is a new technology. So I want to talk to you a little bit about mRNA. mRNA is one of the building blocks of life. mRNA encodes the information needed for our body to make proteins and enzymes. All of our cells need proteins and enzymes to carry out their normal function, and mRNA provides the instruction for the protein production. After proteins are made, the mRNA is eliminated from the body through enzymes, and so mRNA fragments are only short-lived within the body. When we use an mRNA vaccine, we're introducing an mRNA that encodes the spike protein for the virus that causes COVID-19. Our body will take the instructions from the mRNA to produce the spike protein. Our body will then recognize that the spike protein is foreign and produce an immune response to the spike protein. And this immune response will then protect us against infection from COVID-19. The vaccine mRNA fragments will be degraded by the enzymes in our cell, and the mRNA vaccine fragments are short-lived. The mRNA vaccine fragments do not incorporate with the DNA and do not become part of our body. So what do we know about COVID-19 vaccine side effects? First, the most common vaccine side effects are mild and include symptoms like injection site pain, which means pain where the vaccine is administered in the arm. Patients may develop fatigue, dizziness, headache, fever, chills, this type of thing. These symptoms are generally short-lived, lasting 2 days or so, and they're more common after the second dose of vaccine. The Johnson & Johnson vaccine has been associated with a rare but serious side effect of low platelet and blood clot formation. This side effect appears to be most common in women ages 18 to 49. This occurs at a rate of about 10 cases per million vaccines in women in this age group. As a result, I think women less than 50 should consider getting an mRNA vaccine, such as the Pfizer or Moderna vaccine, rather than the Johnson & Johnson vaccine. Currently, investigators are looking into the possibility that the mRNA vaccines, the Pfizer and Moderna vaccine, may be associated with a small risk of inflammation of the heart. This side effect has been observed primarily in men aged 16 to 39. The rate of this side effect appears to be about 16 cases per million population. I think it's important to note that the likelihood of serious harm is far greater from COVID-19 infection than it is from any of these COVID-19 vaccines. So my concern is that our current immunization rate locally is inadequate to protect us against ongoing infection with COVID-19. And I'm afraid the pandemic is going to drag on longer if we continue to have such a low immunization rate. I encourage all of you to reconsider getting a COVID immunization. As I stated, I feel that they're safe and effective. I can tell you on a personal level that I have received the COVID-19 vaccine. The American Medical Association has done surveys, and it appears that 96% of U.S. physicians are fully immunized. I can tell you that my wife, my children, my 93-year-old mother have all gotten their COVID-19 vaccines, and they're all fully immunized. So I have great faith in these vaccines, and I feel that high-level immunization rates are the best way to put the COVID-19 pandemic behind us. Thank you.